Hi, Dr. Curtis here with Longview Spine and Sports Medicine, and I'm here today to share some information with you about regenerative medicine, the different types of stem cells and where they can be harvested. What are their sources? When you're doing a regenerative medicine procedure, you need to have live stem cells. Stem cells can come from fetal or embryonic tissue. Now that, in my opinion, and the opinion of the U.S. government, is unethical, and it's illegal. So we don't really need to talk a whole lot about that. That was a hot topic 20 to 25 years ago during the Bush administration when they changed the laws and regulations regarding stem cell research and stem cell therapy in the United States. The other source is your own body. All of us have stem cells or we wouldn't be alive. And the younger we are, the more we have. In a newborn, one of every 10,000 cells is a stem cell, which is actually a very high amount of stem cells. That's why children heal so much faster than we do as we age. By the time we're teenagers, 1 in 100,000 cells is a stem cell, so it drops by tenfold just in those few years. By the time we're over 50, it's 1 in 400,000, so it drops 4 more times as we age. So harvesting stem cells from our own body is often not the best source, because as we age, we don't have as many of them. If they are harvested from the body, they'll be harvested from 2 other sources. The first could be your adipose tissue or fat tissue. And just because you have more fat doesn't mean you have more stem cells. I'm sorry if you were thinking that. And it's not a 2-for-1 procedure where you get liposuction and you get stem cells at the same time. Everyone gets excited about that, but it's not the case. Unfortunately, the other source where they can be harvested is the bone marrow. And I point to my hip because that's where they drill into your bone to pull out the bone marrow and the stem cells in that area. It's a painful procedure, it's a costly surgical procedure, and it's more costly and the recovery time is longer. The best source of mesenchymal stem cells is the Wharton's jelly inside the umbilical cord. The Wharton's jelly is a tissue that surrounds the arteries and veins and the umbilical cord that feeds the baby from the mother. And it is rich in mesenchymal stem cells to help with the development of the baby. When those cells are harvested, it's typically done with a mother that donates the umbilical cord, something that would have been thrown away anyway. The mothers are carefully tested and screened, and that umbilical cord is then shipped to a lab where the stem cells are extracted. Once they're extracted and processed, they're frozen and shipped to clinics such as ours on dry ice. They arrive in our office frozen, and we keep them very, very cold in a liquid nitrogen freezer, so the cells are still viable when they're thawed. This can be seen in other cases. I know last year there was a news story about a woman in Florida who was impregnated with a 22-year-old embryo, which was older than her. But the reason those cells were still viable is because they were frozen at such cold temperature. And the cells are still viable when they are thawed. We receive stem cells in much the same way, and they're going to be viable and good cells as long as we keep them frozen at that temperature. And that's why we use mesenchymal stem cells from umbilical cord tissue product to give to our patients. I hope that answers some questions you might have had about the different sources of stem cells, where they come from, and how they can be used for our patients. If you have any further questions, comment below, and we'll be happy to answer and review any questions you might have. Thanks.